Jim Mooney. I work as the, I do a couple things at the hospital. I get to do some administrative medicine, so I work as the chief medical officer. But I also work as a hospitalist, so I do inpatient medicine. So what I've gotten the opportunity to do on my administrative side is trying to coordinate new services for the community. And I also get to practice the effects of that on the inpatient side. So tonight, we're actually going to be talking about, this really is the future of healthcare, because we want to access new services. And how do I bring those new services to the community? So I'm going to start unconventionally. I'm going to put the cart before the horse, because this topic is so much better if I show you rather than tell you. And so there's a couple people in the room. So DJ Harbaugh works for, stand up and give a quick wave, DJ. DJ does information technology. So he actually is probably the most important part of this whole coordination. Noah Ganji, who's in the back, he helps us coordinate the marketing side of it, because this is where medicine crosses a lot of different topics. Delivering the information is one thing, but how do you get the people there? How do you get it to the people? And then how do you get people excited about the topic? Right? So I'm actually going to show you tonight, or we're going to show you, I shouldn't say I, because I wouldn't do it without these guys, but we're going to show you how we actually do this. And fortunately, we have a very nice young woman, Chase Carpenter, who has actually been a patient using these services. So she's going to help us show how this works. So just real quick, just because there's nothing like a good story. So I'm going to speak on Chase's behalf for just a couple of minutes, and then you guys are going to have the opportunity to see Chase and Dr. Warren Selman interact. So Chase is 19 years old. She came into the emergency department as a referral from her pediatrician's office because she was at work and she got the sudden onset of headache, some sensory changes. She had some funny feelings in her hands and feet. She had a little bit of a headache, and she also had some neck pain. Now, normally, she had had these experiences before, and she didn't pay a whole lot of attention to them probably months to years before, but this was different simply because of the fact that the symptoms were a little more severe and the persistent nature of it. When she showed up at her pediatrician's office, the pediatrician said, you need to go to the emergency department immediately. When she got to the emergency department, fortunately, most of her exam was pretty benign. In other words, there wasn't a whole lot going on. However, the CT scan showed an abnormal mass with some bleeding right by our pituitary gland. The pituitary gland is kind of in the center of your skull. And you guys might have heard they talk about it as the master gland, because it pretty much runs your entire endocrine system. So it affects your thyroid, it affects your growth hormone, it affects ovaries, testicles, your adrenal glands. So it's really in a very important spot to have somebody this young to have this kind of a finding. So she was immediately transferred to, I put Samaritan Medical Center. It's kind of telling you what I was actually thinking. She was sent to Cleveland. We are no longer the referral center. So we referred her up to Cleveland, and that's where she met Dr. Selman. And then subsequently, Dr. Selman interacted with her on a clinical basis. But so here's the picture. And so as you can see, this is the spot here. As you can see the color just looks different. This is what they saw. That's not supposed to be there. So the nice thing is right away, you have a pretty clear answer that something needs to be done. But it has to be done by a neurosurgeon. So imagine we're standing here in Ashland, Ohio. We don't have neurosurgeons. And so this is why this story is so powerful. So what I'm going to do now is see if we can call Dr. Selman.
How's that?
Perfect. Hi, Dr. Selman. How are you?
Hi there. Good evening. How's everybody doing?
Very well. Dr. Selman, I want to introduce you to Ashland County community here. Not the whole community, it's only part of it. And then I want you to meet Dr. Selman. He's the chair of the Department of Neurosurgery up at University Cleveland Medical Center. And I know you know this young woman here.
I do indeed. Good to see you again.
All right, so what I'd like to have you do, Dr. Selman, is just interact a little bit with Chase here, just about some of the things you guys talked about. She has a microphone because I want them to hear you as well. Okay. And then I'm going to have you kind of speak about the benefits you see for the telehealth services, and I'm going to also have Chase comment on a few things.
All right, well, great. Hi, Chase. How are you doing?
Good. How are you?
Good. I hope everything is still going well.
Yeah, it's going great. I'm back to work full time, and everything's going great. There's no more swelling, no more headaches,
Excellent.
no pain.
Well, I can't even tell you had an operation, so I hope everybody in the room feels the same way as well. But what you went through is a very scary sort of thing, as you know. I mean, you were diagnosed with something that looked like there was bleeding inside an area of the brain. And I think because of the telehealth, we were able to get everything sorted out very quickly, and you didn't have to drive back and forth 2 or 3 times to get that done.
Yep. And then even in the middle of the first one, we changed my surgery up a week, so that was helpful.
Yes, we did. Yes, we did. And we talked about the different approaches, and I don't think I would have been able to explain that to you quite as well if we were just trying to talk over the phone.
Yeah, I got a better understanding because you would like show me where and what to do.
Right, and I think that, you're the patient, so you tell me, but I think that leads to a great sort of sense of confidence and also a feeling of calmness that you can't otherwise get, because when somebody says the word brain surgery or neurosurgery, I mean, immediately, especially if you associate it with the term bleeding or tumor, your mind really tends to wander very quickly and go in places that it doesn't need to go. So I found one of the best things, and you tell the folks behind you and comment on that, but is our ability to interact just like you are. You're talking with me, I'm seeing you, I can show you things, and you can see sort of my face and understand my feelings. And I think we're able to put people at ease because a lot of times it really is something that you shouldn't worry about.
Yeah, I had a smile on my face the whole time when I was talking to you the first time. I wasn't worried at all.
Well, that's great. Jim, do you want to...
Yeah, I think too, Dr. Selma, what I appreciate is that the fact that her mother can be there with the both of you so quickly and so easily from home. So multiple people can show up that otherwise wouldn't be able to if they had to travel to Cleveland.
Right, that's a great asset, and as I said it before, it's not just like talking on the phone or trying to listen to somebody. This is much more than a speakerphone experience. You are in the same room. As you can see, I'm talking to you, and you can interact, and I can react really to your face as well. So I think you really, although it says telehealth, I really think it's a very personal experience.
I agree.
Would you agree with
Yeah,
that?
I agree.
Could you comment on how you accessed her records?
So that is one of the greatest things that makes life, I think, easy for me as well as easy for you. So instead of waiting to carry a disk up, load it on a machine, and try to wait until that gets done, and then sometimes it doesn't even work on different machines, I'm able to simply look into either our own PAC system or directly log into Samaritan Cerner system. I can see all the studies ahead of time. I can form my opinion. I can even ask my colleagues, because a lot of times we do things by consensus, and I don't want to just be the only one saying, well, this is the way I think it ought to be done. It really is good to have a team, and we always work in a team, whether it's for tumors or spine or cerebrovascular. So this really gives me the opportunity to do that ahead of time, and then by the time you come into the office, I really have things pretty well formed, and I'm able to communicate with you more directly rather than saying, oh, it's nice to talk to you, let me take your history, I'm going to go outside the room now and look at these studies, and then I'm going to come back and, oh, by the way, I need to look at a lab study. So it really, to me, is a much more efficient system. I know Dr. Furlan, my partner in neurology with this in the Neurological Institute, says actually these telehealth visits actually are better than the in-person visits because we do so much more ahead of time.
Yeah, that is true. I've actually seen that interaction where we've given you information, you've had time to think about it, ask colleagues, and come back and give us a much more defined answer that otherwise the person would just sit there waiting for probably weeks at times.
I think so. It really is efficient and, again, very personal. I can't emphasize how much the ability to see someone, I can tell you're smiling already. Those kind of things are just visual cues that you can't get any other way, and you really don't lose that in the telehealth presence.
Can you talk a little bit about how you find when the nurses are trained to do what it is that you're looking for, how that helps you in terms of like maybe something simple like on an exam or something?
So very much so. So obviously, although the images are important, the history is important, we really need to do a physical exam to make a lot of our diagnoses. And so we've really partnered very closely with your nurses and our nurses as well to help educate them, because it's the same thing in my office visit. The nurse will do a lot of the preliminary examination so that when I walk in, I'm not sort of guessing or make the patient repeat something. But the nurses are actually very skilled at allowing a patient to either walk with assistance or do a mini neurological exam for the mental status or even physical examination. I mean, it really is impressive how much information you can get just by asking a patient to stand, hold out their arms. And the nurses are very well trained and can say, this is what I see. And obviously I'm also there at the other end to overlook that and say, could you test this or could you try doing this? So really it is, again, a very personal sort of experience.
Before I have Chase comment on a few things about the follow-up, I want to tell the audience a couple things. So, as I said, she went up to UH Cleveland initially because there was an emergent issue regarding the bleeding with the newfound tumor. So, after that initial encounter, Chase returned to Ashland. Dr. Selman saw her preoperatively for just coordination of care issues. And that's when, fortunately, Dr. Selman does have a sensitive heart. He noticed that they had scheduled her for surgery on Valentine's Day. And he said, you know what, that's probably not a good idea. Let's switch it. And they were able to switch that with conversation prior to surgery. Then Chase went up for surgery and then came back to Ashland. She did have to go back up because she had a scar that nobody could see, which, congratulations, it's a phenomenal piece of work. So it cuts right across here, but she's able to cover it. But they did have to remove the stitches. So she went back up for the stitch removal. But then her follow-up appointment after that was through telehealth. So I just want Chase to comment on just a couple things about what was that like doing your follow-up neurosurgical visit by telehealth.
It was a lot more helpful because it's less driving for my mom and stuff to go all the way up to Cleveland and back, and it saved gas. And like he said, it's like more personal experience. You can see his face and talk to him. He could have easily called me and asked how I was doing with everything, but the telepresence made it a lot better. So
Did you feel comfortable with the notion of you're doing a neurosurgical follow-up by telehealth?
With him, yeah. Yeah. My mom was asking a million questions. She's like, how is he going to see that it's okay? How is he going to be able to tell? But he just asked me how I was feeling, how my reactions were and everything, and how the incision looked. And they looked at it when I got my staples out, too, and they said it looked really good. So.
Well, I do want to comment about, Chase's mom actually works in our offices she coordinates what we call concierge services. So she tries to make sure that when people leave the office, they have a follow-up appointment scheduled. So it was very helpful. It was nice of you actually to have his tumor so that she could actually practice it. So this is a great daughter right here. I'm telling you. She'll go to great lengths for her mother. So what was kind of interesting about it, though, is that Dr. Selman, and he was watching the interaction between the mother and the daughter, and Sonia told me that you had seen that she had something in her hand, and you knew that she had a bunch of questions. And she was very impressed with the fact that you actually said to her, okay, now Mom, what are your questions? Because you could actually see that. Do you remember that?
Yes, I do. Yes, I do. And it's wonderful that she wrote everything down, but you're just sort of waiting. So obviously my interaction was with Chase, but I always kept the corner of my eye open and saw that list waiting.
But it's remarkable that if you guys sit in this room, it's, that as Dr. Selman was saying, the audio is incredible, the visual, but that he could actually even watch the subtle nuance between the mother and the daughter, which is obviously, it's a very important part of the follow-up here, right?
Absolutely.
Yeah.
Absolutely. It is a family affair.
No question. So I would just ask a couple more favors. One is just to give us a couple thoughts on overview. What would you like to see? What kind of things fit well in this telehealth presence?
So we don't want to limit anything, but that said, certain things are better and easier. Obviously, the more critical and time-sensitive it is, if you need to get a hold of us, then do that. As Jim knows, he can give me a call. We can hop on this thing anytime. We do have established, quote, office hours, if you will, but we're able to provide this telepresence literally, any day of the week with very short notice. So I would say with that said, the one thing that, for instance, I'm part of the Neurological Institute, so we cover a broad range of diagnoses. If you have something that's going to require a very detailed neurological examination and try to figure out, well, is the deficit in the first finger, the second finger, the third finger, and does it split that finger? Some types of those things are probably better done by an in-person examination. But if we're talking about something where you just get a diagnosis, need us to look at a film and a exam in the office will do, then I think we can cover almost everything in neurology or neurosurgery by this type of telepresence. So I urge you to not limit it too much, and I know the docs down there and I have had some conversations. I've gone down for a visit. Everyone feels very comfortable with each other, so I think we have a personal relationship. And again, I want to stress how much that is important, both the cooperation on both Samaritan and Ashland's end and our end, and that we haven't just talked over the telephone. We've made, excuse me, personal visits. And so there is that level of trust, and you all should feel comfortable knowing that if, just come in, do a telehealth visit. If it doesn't work, then obviously we can have you come up. But I would say almost everything can really be covered by this, except the most subtle of neurological diagnoses.
Okay, thanks for sharing that. So